Here you can see a variety of common causes of attachment disorders. Obviously, these causes vary dramatically in both severity, frequency, and whether they are medical or socially caused. It is also poignant to note that whilst a selection of these causes refer safeguarding issues and negligence, some attachment disorders can be caused by factors outside of caregiver control. Illness or pain that cannot be alleviated by the caregiver, such as ear infections or other medical or genetic disorders that create barriers to attachment, are just a few examples of these. These reasons are important to acknowledge, as if a child is diagnosed with an attachment disorder, it is important not to be prejudiced against the caregiver's ability to provide comfort for their infant. Causes of attachment disorders can be hard to identify, so it is important that we can recognise the signs associated with different attachment disorders. The effects of attachment disorders work on a spectrum. Some students will experience minimal effects, and for others, the effects can be traumatising. They can also vary with frequency, some being constant, while others rarely present themselves. Have a think about the children that you have been working with. How many of these signs can you identify amongst them? Later on in childhood, the signs of attachment disorder can also include the large list you can now see on the screen. Children with different types of attachment disorder will display different tendencies, and this non-exhaustive list creates a problem when trying to diagnose attachment disorders. A child without attachment disorder could display a number of these signs, whilst a child with insecure attachment may display only a couple. It is therefore necessary for a paediatric psychiatrist or psychologist to conduct a thorough, in-depth examination to diagnose reactive attachment disorder. The child's evaluation may include direct observation of interaction with parents or caregivers, details about the pattern of behaviour over time, examples of the behaviour in a variety of situations, information about interactions with parents or caregivers and others, questions about the home and living situation since birth, and an evaluation of parenting and caregiving styles and abilities. The evaluator will also want to rule out other psychiatric disorders and determine if any other mental health conditions coexist, such as intellectual ability, other adjustment disorders, autistic spectrum disorder, or depressive disorders. So, how do attachment disorders affect learning? Insecurely attached children have difficulty in making transitions. This has major impacts when moving between schools, key stages, year groups, and even classrooms throughout the day. Attachment disorder manifests within learning episodes as the following. Students are unable to follow a coherent narrative. This means they may struggle to follow chronology in English and history, as well as follow sets of instructions. Therefore, information needs to be provided in small steps. They may well respond really well to this approach, so appropriately differentiated work may not provoke any signs of attachment disorder. Students will also fail to take the risk of learning because their self-esteem is low and the child is not prepared to take the risk or make a mistake. Students will resist attempting learning activities as this removes the possibility of failure, a highly negative emotion that has not been comforted in their past. For many students with attachment disorders, learning is superficial, with their focus on the outcome rather than making sense or developing a meaning of what they're learning. Students may learn facts and keywords, but may not retain them in the mid or long term and not grasp the true concepts or deeper explanations. They can struggle to apply knowledge to new situations or problems that are worded differently. All of the above, combined with a lack of belief about success within academic learning, means that their attention and motivation to engage is focused on disruptive behaviour, which in turn leads to more rejection and loss for the individual. This final point really emphasises the reasons why attachment disorder needs to be identified and treated appropriately to avoid further harm to the individual and their future. For example, for a student who is disengaged and disruptive in class, it is important that educational professionals do not reinforce the rejection and disattachment that the student has already experienced within their lifetime. We are now going to look at a variety of strategies to help support students with different attachment disorders. It is important to recognise that you will need to select appropriate strategies for your students, especially as some of the advice is seemingly contradictory. This is because every case is unique, and you will therefore need to differentiate strategies for each unique student. First of all, having a structured environment. A structured environment and classroom schedule helps the child to feel safe, and thus they will cooperate better within school and with its demands. Prepare children for changes in the schedule in advance, such as field trips and special events, class parties or guest speakers. For staff, it is important to always be predictable, consistent and repetitive. Children with attachment disorder are very sensitive to changes in schedules, transitions, surprises and a chaotic social situation. This will help the children to feel safe and secure, which in turn will reduce anxiety and fear. Break assignments into manageable steps to help clarify complex multi-step directions. This will ensure that the child can understand each step as they proceed throughout learning activities. Behaviour management and level systems are based on consistency, and this consistency makes these plans easy targets for children with attachment disorder, who may manipulate the system for their own purposes. Whilst these systems also let students know what is important to their educators, students with attachment disorder may use these systems to draw educators into useless discussions about behaviour. Most of all, remember that they are just children who are trying to feel safe and secure, while fighting for themselves against a world which they perceive is attacking them. We'll now look at maintaining control. Children with attachment disorders feel the need to control and manipulate adults around them. Adults who are consistent or those who use the same behaviour modification techniques become predictable for these children. Therefore, teachers must carefully consider each situation and adapt their strategies accordingly. Another way to maintain control is to have a business-like relationship with the child in the class. If the child feels that the teacher is being overly caring or helpful, they may feel threatened and thus react by doing other things to gain control. One important factor that must be kept in mind while trying to maintain control is to control one's emotions. Children with attachment disorders try to manipulate the emotions of the adults around them. They may try to hurt or anger the teacher in order to show that they can control them. Therefore, the teacher must thus, in all situations, maintain control of their emotions. They must learn not to lose their temper or react in anger. For doing so, they will lose the battle. This may seem in conflict with previous advice to make sure your approach is consistent and predictable. However, as we saw when looking at signs of attachment disorder, behaviour can present in a variety of different ways. Therefore, it is important to work with staff, professionals and caregivers to identify which of these strategies works best with each of your particular students. Another way to maintain control is avoiding power struggles. When intervening with behaviour, present yourself in a light and matter-of-fact style. This reduces the child's desire to control the situation, and when possible, use humour. But again, only if that is appropriate for that specific situation with that specific student. Finally, it is important to model and teach appropriate social behaviours. One of the best ways to teach these children social skills is to model the behaviour and then narrate for the child what you are doing and why. Always be explicit and keep language clear, precise and simple. Remember, less is more regarding language in this context. It is also important to teach the concept of choice. Children with attachment disorders need to learn that they are responsible for the things that they do. They tend to make themselves feel that they are forced to do things and that they cannot control their life. Thus, the children need to be taught about good choices and bad choices. When they make bad choices, there should be consequences, and they need to be taught how to avoid these consequences by making good choices instead. An easy method of doing this is using the conditional yes response in place of no responses as often as possible. For example, of course you can go and use the computer, just as soon as you finish your maths paper. This also acknowledges and praises the good decision that you're assuming the student will make. However, with praise, remember to be specific. You've been good today will generally mean very little to a child with attachment disorder, whereas you have written that down beautifully, your writing is very neat and clear and looks lovely, will mean a lot more. It is also important to look out for non-verbal behaviours. A teacher must remember never to necessarily trust the words of a child with attachment disorder. This child may say many things to impress and manipulate the teacher. Instead, keep a close watch on the child's non-verbal behaviour. It is often this, the eyes, hands, gestures or facial expressions that will tell you what the child is really thinking or feeling. Non-verbal behaviours such as rocking, headbanging, biting, scratching or self-harming are classed as soothing behaviours. These symptoms will generally increase during times of stress or threat. and it is important that you identify a place for the child to go in order to regain composure, but also where they will be safe. The most positive strategy is that of the staff to act as a positive historian. Children with attachment disorders tend to forget the good things that happened in the past when one bad thing happens to them in the present. Thus, the teacher may sometimes need to act as a historian to help the child to remember the good things of the past to keep things in perspective. It is therefore important to stay patient. The process of change may not be a fast one, and there will be difficulties along the way, but also to have realistic expectations and focus on taking small steps forward and celebrate every sign of success with the child. It cannot be emphasised enough that these strategies should be applied with empathy and never anger. The goal is to return the responsibility back to the student, not to punish them. Remember to remain calm, smile sweetly, and be kind, because inside there may be a scared, hurt, and lonely child.
You will now see the final question section followed by the evaluation. You need to make sure that you fill out the evaluation in full and reach the Submit button at the end of the course to ensure that your results are submitted for assessment. One of the training and development team will need to assess your responses and will notify you of your outcome as soon as possible. Thank you for taking this Prospero Teaching online course.